and then we can go ahead and get things started. You want to
Sounds
kick us off, Patrick?
Sure. All right. Thank you, everybody, for coming to our third webinar on combating youth vaping in Arizona. We certainly appreciate you being here today, and we are recording this, so if you want to come back and review anything, or if you have other folks that might be interested in it, then we can certainly get this sent out to them afterwards as well. All right, so let's go ahead and open up the chat, and you can share your name, what school or health department you represent, your preferred email address, and what brings you to this call today.
And we'll use that kind of as our attendance record of sorts. So appreciate you putting your information in the chat. Don't be shy. I'm hoping, though, now that I say that, I'm wondering, there we go, there's Alyssa. If folks do not have access to the chat, if they are external partners, sometimes if you don't have, if you're new to Teams, you may not have access to it. All right, I see Katie responded. Wonderful. Oh, there we go. We're getting a few more. I just had to be a little more patient, that's all. All right, wonderful. I see. Continue to put those in the chat. I will ask you to be thinking through one of the, as we get towards the end today, would love to do a little just brainstorming or discussion on some of the challenges or some of the successes that you've had. So as you're listening in today, if you have something you want to share or a barrier that you've run up against, I'll ask you to share that later in the call. But I want you to be thinking about that as we go through the next few slides. All right.
All right, so this just to let you guys know, all references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine products, and not the tobacco and or other plant mixtures grown or harvested and used by indigenous people for sacred purposes. All right, so today's objectives for preparing for implementation, considerations and recommendations for successful implementation, supplemental learning opportunities, challenges and successes, technical assistance and incentives, as well as some time for some question and answering at the end as well.
All
and
right.
I'm going to go ahead and pass it over to Michelle, who will get us going here. Thank you, Michelle.
Great. Thanks, Patrick. And just really quick to introduce the team, we've got Patrick, who you probably have heard from through emails. He's the one who's been sending out some promotions and communications. We've got Alyssa Keel, who also is one of our technical assistance team members. You'll hear a little bit more from her later on. My name is Michelle Mercure. I'm the director for nationwide tobacco programs, which includes oversight of our INDEPTH program, as well as the number of our other youth programs as well. So our team is here to support you and provide some guidance. So again, I will offer up the opportunity for you to ask some questions, but if something comes up, I'm trying to keep the chat live on my screen, but as we get going on this, if you have a burning question, you don't have to wait. You can either pop in and ask it, or put it in the chat, and we'll be sure to get to it at the end. If this is your first time that you're joining us, or maybe your second time, we welcome you. So thank you for being on the call. We do hope that you will take some time and go back and review the other sessions, which we covered previously in January. We provided an introduction and overview about INDEPTH, And then in February, we talked about some tips for working with schools. And as I said at the onset of the call, today's content might have some overlap, but we'll take a deeper dive on a number of the materials that we're talking about. And today's call will focus on some of the best practices and guidance for program success. So let's go ahead and get started. By way of, just a brief review, this is just an overview slide of what INDEPTH is all about. So INDEPTH stands for the Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. It's a mouthful, I know, but the program is intended to be an alternative to suspension program. It's geared towards helping youth, enabling them to explore their own tobacco use, including e-cigarettes, to look at and understand a little bit more about nicotine dependence, look at establishing healthier alternatives, and ultimately, hopefully making the change to be free of all tobacco products. It's meant to be offered as an alternative to suspension or citation program. And so in that regard, it's intended to be a mandatory program in order to fulfill the obligation for the tobacco policy infraction. It's not intended to be used as a prevention program. That means, in other words, it's not supposed to be for any students. It really is intended for students who have gotten caught or who are certainly current tobacco users. The program is administered by a trained adult facilitator and can be offered in a school or community setting, and we'll talk a little bit more about that in further detail as we continue on. So when we look at the content, we have really kind of two different modalities. The first one is an in-person program. The program is broken down by 4 sessions. Each one of them takes approximately 50 minutes to go through. I say approximately because sometimes it takes a little bit longer when you add in the pre-survey or the post-survey, depending on the number of students that you have, or if it's being offered one-on-one, it can change a little bit. But it's flexible in how it's implemented. So sites can offer it all 4 in one setting. I think, and I know this ages me a bit, but kind of like a breakfast club situation where they come in on a Saturday or after school, or it could be done during a lunch period, or it could be done in an in-school suspension setting. And again, we'll talk through some of those different options later on. The program can be offered for the in-person piece of it can be done in a group setting, or could be offered one-on-one, although that's not as effective or as efficient, I should say, if you're doing it one by one. And the program can be offered virtually, so it could be offered using Teams or Zoom or something like that if you had students that you needed to connect with, or students from multiple schools or multiple settings to offer it at the same time. So lots of flexibility in how the program is implemented. We recently launched our in-depth online version of it. So this program is mostly the same content, some modifications and improvements, I'll say. It is also 4 modules. The content, again, mostly the same. It takes about 2 to 3 hours for the students to complete that. It's a web-based program. There's no app or anything that they have to download, but they do have to be able to connect to the internet in order to, I just realized I have a typo on my slide, sorry about that. You have to be connected to the internet to be able to advance through the program. It addresses vaping and all other commercial tobacco products, but it's a slightly different order, and so it's not meant to go in place of or in tandem with the group program. It's meant to be a separate version of it. Some of the content, we've ramped up some of the mental health content in the online version, and we'll be kind of backtracking and doing that with the in-person program in a refresh that's taking place in the next couple of months. The in-depth online program includes knowledge checks and includes some baseline data and evaluation that's built throughout the program. Both of the programs include a certificate of completion that the students receive upon successful completion of the program. So for our in-depth online, a couple of separate components, some things to be aware of is that there is an organizational site administrator portal. So that means that a school or a school district or even at the county level can kind of look at and monitor what's happening with different programs across different locations. So the organizational site administrator can kind of see who's being referred into it, and they assign facilitators to work with each of those groups. So, and those facilitators then can monitor their progress and completion. There are also opportunities to engage with the students and interact with them as they go through the program. So even though they're not facilitating a group, they can, check in with the student once a week or whatever is determined to be the timeline to see how they're progressing. If they have questions, provide some additional encouragement and support and those kinds of things. So that's kind of, it's not meant to be we're just totally going to hand them off to the online program and expect that would be the only piece that they do. There is still some responsibilities on the part of the site, either facilitator or the organizational admin. So I've already talked a little bit about the student activity. It is self-guided, but there are there's a discussion guide that the facilitators can use. For those of you who might be familiar with, we do have an online version of our Not on Tobacco program, which is our Quit Tobacco or our youth cessation program called Not For Me, and it's a very similar format. And the program does offer opportunities for referral directly into those programs, as well as other programs as well. So, all right. For either of these, we do encourage and in fact require somebody at the site to be trained as a facilitator for in-depth. And what that means is that you would take the in-depth facilitator training course, which is available online. It's free. It takes about an hour to complete. It does not have to be completed all in one session. It can, you can get through half a module or the entire first module. There's 3 modules total. And when you stop, you can leave and come back, and it'll bring you back to the same place that you were. You do, at the end of that curriculum, or at the end of that training, excuse me, receive the curriculum, the facilitator guide that has all the student handouts and all the materials, resources that you need for program implementation. It also includes for you as the facilitator a certificate of completion as a certified facilitator. It is a 3-year certification, but then it also includes student materials, as I mentioned. So the handouts, a certificate of completion for the students that you would then fill out once they've completed the in-person, and then also some guidance for successful implementation. We are, although in-depth online hasn't been directly incorporated into this training quite yet, we are encouraging sites that are offering in-depth online to also take this training so that you have a foundational understanding of what in-depth is all about, what implementation looks like, what pieces you need to have in place, what best practices are, a review of content, understanding tobacco products, all of those kinds of things. All right, so here's where we get into the nitty-gritty of it. So some considerations and recommendations for successful implementation. So this next slide, I tried to keep it simple, but I want to kind of go through step by step. These are some things that you should be working with, talking through, or considering as you're starting to implement or launch your programs. So the first one is, what is the school policy? And there's a lot to that. Is it a comprehensive policy? How is it communicated to students, faculty, and families? How is that policy relayed within the code of conduct at the school? What do students know about what happens if they violate the policy? What does it mean for extracurricular activities or sports? What does it mean for academic performance? What is all of those things? It's important to kind of understand that framework, because that allows you to support and implement the program more how am I trying to say it, easier. It'll be easier for you to implement it if you have a referral mechanism in place and that's clear and outlined both in the policy, but also how it's expressed to the students, that they know that they'll have to go into an alternative to suspension if they violate policy. First offense means they have to do this. Second offense means they have to do that. As you are doing that, you may find that there are some pieces in the school policy that might need to be changed or modified, or maybe they need to be updated a little bit, or communicated or enforced in a different way. So you're encouraged to kind of look at that policy or code of conduct and see what would further support implementation. How can you further outline what those steps look like? So that's a lot to consider or just review and think through as part of the school policy piece. Another piece is to determine what happens when a violation occurs. And you'll notice for some of these, and as I go through this, I'll give you some suggestions and some options, but we're not going to be very prescriptive about how you need to do this, because we want you to be able to be flexible and implement and support the schools in the best way given the circumstances that they're in. So, for some, when a violation occurs, parents have to be notified immediately, and there's an automatic, in-school suspension or whatever. So you need to understand what happens. What's the process? Who determines what the consequences are? Is it the principal, the dean? Is a guidance counselor pulled in to provide some, some support, some guidance, some assistance, or who handles what that disciplinary process is? As far as that kind of leads into the referral process. So what is that process, and who monitors the student progress and completion? So determining who it is that's going to facilitate a group, who's going to make those referrals into it, who's going to monitor and say this student has met the criteria for fulfilling the obligation as a result of their policy infraction. So, again, that referral process, is it in person? Who might facilitate the program? If that is, it might be different than the person who handles the disciplinary response. Maybe it's the guidance counselor or the school nurse. Will they have the opportunity to do the program online? In that case, who is the point person to make that referral to the student? Who will monitor their progress or maybe do in check-ins? Also, as a part of that referral process, at what point and what information is shared with the parents? What notification is given to them? We do offer some sample resources to support that. A letter to parents that can be crafted and modified, which makes the most sense for each school to use. But we give you some samples for you to do that. But maybe there are some additional components and some additional information you want to share with the parents as a part of that disciplinary process. And then also, as far as the referrals are concerned, it's also important to think about the kind of follow-up. So I always talk about INDEPTH as kind of being the old adage, you can lead a horse to water, but you can't make it drink. The idea here is that INDEPTH is intended to kind of make them thirsty. So you want them to encourage them to consider finding quit resources. Maybe at the end they've decided to quit, and that's fantastic, but the intention of the program is to prepare them to say, wow, I think I really am nicotine dependent and maybe I need some help here. But then we've got to give them the resources to be able to help them. So it's really important to include a referral for quit resources for cessation. So who does that? Who can help with that? Is that the guidance counselor? Is that a school nurse? Is there a healthcare provider? Are there community members, treatment centers, or other places that you would refer a student to help them through that quit process? Or maybe it's an online program or a text program or a not for me program. There's lots of different options out there. You just need to identify what that looks like for you and your students and the school that you're working with. And then determine what successful completion looks like. So, meaning if they're doing the in-person, they have to complete all 4 sessions. What happens if they miss a session? Can they make it up? How do they make it up? and having a plan in place for that. Can they repeat the program? Yes, they can. That is an option. And again, they do receive a certificate of completion. So once they've gone through, the facilitator in an in-person program signs that certificate indicating that the student has completed. Perhaps they need to submit that to the dean or to the principal to say, I fulfilled this obligation, or I've completed the program. If they are doing the online program, there are, evaluation checks and knowledge checks that are included. There are discussion and check-in requirements. If that's the case, what does that look like in determining how often do they have to check in? What's the term in which they need to do that? Do they need to complete the online program within 2 weeks? Do they need to complete the online program within an in-school suspension period or after school, and they need to, go through the process? So again, not going to be completely prescriptive about how you do that, just make some recommendations and ask you to kind of think about what does that look like in your particular situation. And then an additional piece is to look at what happens with subsequent violations. So like I said, can they repeat the program? Yes, they can, but maybe you want to have other consequences. So some schools, for example, consider online for the first offense. So if a student violates the policy the first time that they have violated that policy, they meet with a counselor or the dean or the disciplinarian, and they talk through what the consequences are and may be referred into the online program. And then subsequent offenses, they would have to go to an in-person program, or maybe they would need some additional counseling or support or referral to somebody else to provide that a little extra urge or nudge to kind of get them on their way. Okay, so kind of want to talk through some of the other components or pieces of it, some things for you to consider. So when I think about who the team is or who the program might touch or connect with, these are kind of the connections that I'd ask you to kind of think through. So the schools, for starters, the program, and I want to kind of provide this guidance that the INDEPTH program was written and has been evaluated for middle school and high school students. Now that can mean, depending on where your middle school starts, it could be 13 on up to seniors who maybe graduate at 19. So I try not to do an age restriction necessarily on there and just basically say it's primarily for middle school and high school. I don't know if some of you have heard this. I know this came up on a previous call. We have had lots of inquiries about, can this program be utilized in an elementary school? We have some 3rd, 4th, and 5th grade students, unfortunately, that are coming in with vaping devices. So what to do with them? I'm a certified tobacco treatment specialist, and as I've been trained, and you look at the nature of the addiction to nicotine or the dependence on nicotine, I really feel it's important to reach out to students and support them where they are and when they are there, rather than saying, oh, you're only in 3rd grade, we can't offer that until we're in middle school. However, the program can be given, it just needs to be modified for a younger audience. So there may need to be some changes in the language or some of the terms that are used. There may need to be some difference in some of the examples, or understanding a little bit more about experimentation leading into nicotine dependence, and some of the subtle nuances that might happen with a 3rd grader versus somebody who maybe is a junior or senior who's been using for 3 or 4 years. So it might just look a little bit different, but nonetheless, you do have permission to make some of those modifications and how you could adapt if need be for a younger audience. Another team kind of connection, something else to consider is, who are those facilitators? Who could offer this program? And it really could be any trained adult that would have permission to do so in the school. So some schools prefer to identify a contractor that comes in, outside of the school, a community partner, a treatment center, or somebody from the health department, or somebody else that comes in. Sometimes there are school champions within the school. It could be a coach, it could be a health teacher, it could be the guidance counselor, it could be the school nurse. A lot of them have a lot of different roles. So, you can think outside of the box too and have somebody, again, with the school's permission. You can't necessarily have a parent who just says, I really want to do this. They've got to go through whatever the protocols are within for working with students and being approved to do so. So, but the facilitator doesn't have to be the traditional person that you think of necessarily the disciplinarian or the school counselor or the school nurse. There are lots of other folks that might be willing to do that and support. So our organizational administrators, and that is more in regards to INDEPTH Online. So that's somebody who wants to kind of have an understanding of what's happening across multiple sites. Or maybe it's, somebody who has their finger on the pulse of what's happening with policy and all of that. So kind of think about within the organization, who are the key people that need to help make that happen and what do they need to know about it? Along with that, we have our school administrators. So while it's important to have that local champion, it's also important to make sure you've got buy-in and support and understanding of the school administrators, that they understand why an alternative to suspension is better than just pulling a student from the school and suspending them, which is, sometimes the knee-jerk reaction or how they've handled it in the past. And really a restorative approach, an education and intervention approach is more successful than removing them from the classroom, because then they can go home and use tobacco for whatever way they want to without anybody there. So just helping them understand the importance of why a program like INDEPTH or an alternative to suspension program is key. It's also important to reach out to school staff. So understanding for referrals, if they catch a student, what's the process? If they suspect that a student is using tobacco products, what can they do? How can they support? What can they offer? Thinking about community partners, again, if your school doesn't have the capacity to do that, or if you are a community partner and you want to come into the schools and say, I know you may not have staff to do this, but I can come in and offer this program, and here's how we could roll it out. We do have some court systems or some judicial systems that for some schools, they're issued a citation and then it's put into more like a diversion program, and it's handled through the court. So that's an opportunity to do that, as instead of the citation, they're required, or if they have a citation, they're required to complete INDEPTH. So it could be done in that way. And then, of course, it's always important to consider parents and family and what wraparound, what additional components or what information and resources can you share with parents to help them understand a little bit more about the program. Okay, so as far as the policy, again, a little bit more in depth with that, reviewing the school policy, making sure that it is a comprehensive policy that incorporates, how it's being enforced and how it's being communicated. Is that policy incorporated into the code of conduct and any of their extracurricular codes and what they need to know, what the students need to know, and how is that also then relayed to the parents? So we do have, while the policy is the major piece, and most schools do already have a comprehensive policy, how that's relayed or what the process is part of what also should be discussed or considered or reviewed. What does that referral process look like, and how is it outlined within that code of conduct or within the school policy? And again, some of this is repetitive from other areas, but what is what's considered successful completion, who's monitoring, who's doing check-ins, all of those, and what happens with subsequent infractions. So all of that kind of rolls down into what the policy is, but also what you need to be able to implement successfully. Looking at what other additional resources are needed. So what do you need to be successful to implement it at the local level? What materials, printing, support for quit kits or some other things, and we'll be able to talk through and help you with some of that as well. And then again, as I mentioned, understanding and knowing what those quit resources are available locally so that you can make referrals when they are ready. All right. As far as location is concerned, lots of different opportunities here too. So it can be done in school or out of school. It can be done as a in-school suspension. And while we're saying alternative to suspension, sometimes it's pulling them into a different classroom or a different place to have them, kind of do something. You might still be pulling them from classes, but at least they're not being sent home. So what does that look like? And you can kind of talk through that. Is the program offered as a detention? Do they have to come for, every Tuesday for 4 weeks to complete the program? It could be offered before or after school. It could be offered in, during the lunchtime. It could be offered, as some other type of diversion program. And then, as I've mentioned before, it can also be hosted or facilitated. So hosted elsewhere, or you can have a community partner come into the school to do it. And I mentioned the judicial system piece before, and then also, again, cessation as knowing where you can make those referrals and including that as part of your process, the planning process as well. Scheduling, thinking through what does the program look like from start to finish. So if you have a student who violates policy on the first of the month, when is your in-person program? When does that start? Does it start, is it always on the third Wednesday, or you start the first Wednesday of every month? What does that look like? So really kind of thinking through what a schedule might look like. When is it going to be held? Where is it going to be held? Who is the facilitator who's going to do that? Is it one facilitator? Do you rotate facilitators? Do you have multiple start dates on a rolling basis, or do you just offer it once a month? Lots of different options, lots of different flexibility for how you do it, just something to kind of think through and talk through. And as we talk about shortly here, talk about some of our the technical assistance and the support that we can offer. If you have those kinds of questions, you want to talk through that, that's part of why we're here, is to help you troubleshoot and go, okay, well, maybe you want to consider trying this, or if this is what your school is indicating, how can we address that? How can we do that? So we can help you troubleshoot and get through some of those challenges. Something to think about the INDEPTH online program is that it does allow for an immediate referral. So if a student has a violation, maybe you have to contact parents, or maybe they, there's, something else that they have to do. But if you are offering the INDEPTH program, once a month and, once a week during that month, or if you're offering it on a Saturday, the INDEPTH online allows you to have that intervention at a time when a student is, if they just got caught, that might be a really good learning opportunity. So within the first, 10 minutes, you could make a referral, get them enrolled, and have them start the program that immediately if need be. But also in considering with INDEPTH Online, we do recommend that you have touch points with that student. So it isn't just put them in the program, let them finish it on their own, they give you the certificate of completion. There are 4 different modules that they have to complete. So having a check-in, and whether that's a scheduled, we're going to meet, on Friday of this week, and I want to see how far you've gone, and then we'll meet on Tuesday and the Friday of the next week, and you have 2 weeks to complete it. So outlining that, allowing for check-ins, and the online site does have resources for facilitators to ask some probing questions. You can monitor the student's progress and see that they've completed sessions 1 and 2. You can see a couple of the answers to their questions, like what surprised them most about the content in that particular session. And then they also have, what other information do you need to know about, or what questions do you have? And that gives you or the person who's the facilitator an opportunity to have a little bit of a dialogue. Provide some accountability for the student to see, are they really going through the program and really processing it? It's really set up in a way that they can't just auto enter stuff. They have to be able to respond. They have the knowledge checks they have to pass by 80% or they're not able to advance. They have to complete all of the different modules before they can advance. So there are some things in place, but if you want to interact with the students on a more regular basis rather than facilitating a whole group, or rather than working with them one-on-one the entire time, you can just have touch points for it. And again, for both, just determining what is considered completion and what is successful for that. So to kind of summarize this piece of it, again, just the INDEPTH program is intended to provide education and awareness. It's an intervention program. It's not intended for general education, so it's not a health education curriculum. It's not appropriate really for students who aren't using. It addresses a person who is has the potential to be nicotine dependent, who is using tobacco regularly and got caught. So it's not meant to be completely a prevention or general education program. There are skill building components, communication, stress management, some of those pieces that are in there to kind of introduce healthier lifestyles and to kind of self-reflect and look through what the student is going through to address that. And this program is, while it does address vaping, it also includes other types of tobacco products, because we know a lot of students start with vaping and then progress to other types of tobacco. So important to include that as well. I include this, and I'm happy to make available a PDF of the slides today. And again, we've got the recording of it, so you can go back. But if you need guidance in response to do we or do we not have vape detectors, our philosophy is that vape detectors are primarily set up to set up the students so that they get caught and is more likely to lend itself to a punitive approach. There also are consequences for students who are not tobacco users for vape detectors that causes some concern for them to be, they're not able to use the bathroom because they're afraid they're going to get in trouble for something that they didn't do. So there are lots of different considerations for it. So this is just our stance and our guidance for that. Okay. The next couple of slides, I wanted to talk about some of the additional supplemental materials and resources that we have. This is aside from our technical assistance piece, but we do know that sometimes you want some additional wraparound care, both for yourself or maybe for some other people within your schools. So I wanted to share a few things that we have. Starting with lung duct training. Now, when I talked about the INDEPTH facilitator course, it is available on lung duct training. That causes some confusion for some folks. We have lung.org. That's the American Lung Association's website. And then we have kind of a branch of that, but it's not the same really domain. It's lung.training, and that's our learning management platform. So that is where people can take our facilitator training courses. That includes INDEPTH and NOT, and our freedom from smoking trainings. It includes a number of other trainings and other lung diseases as well. But as it relates to this, those are just some of the key facilitator trainings. We have a series of basics courses that include everything from tobacco basics, advocacy basics, asthma basics. Those are all available on there as well. There's also one for infectious respiratory disease. So maybe it's something of interest or maybe not, but there's a whole series of basics courses that are available. And then there's some additional support. So we have, and I'll talk about this in just a moment, we do have a program called ACT to address youth cessation. It's in partnership with the American Academy of Pediatrics, and it offers guidance for ask, counsel, treat. That's what ACT stands for, and that is to how do you intervene or how do you talk to a student that you suspect may be using? So it's not necessarily the alternative to suspension, but for somebody who, for colleagues that are like, I'm not even sure where to start, it could be a great resource for them to review and take a look at. For adults, also under that support category, we have how to help people quit. And I would say also underneath that support category, we do have the Vape-Free Schools policy assessment toolkit. That's just a one module, about 15-minute program that's available. The good thing about this is when you do the sign in and the register, that once you're signed in and you have a username and password, it works across all programs, so you can come back in and take other programs or review other programs. Many of them are free. All of them, again, kind of remember where you are, so you don't have to complete them all in one session. There is a site, the support icon that you see at the top offers a great place if you need to reset your password or if you're having some issues. There's an easy ticketing system, and they usually get back to you within a couple of hours, if not sooner, for any questions that you might have. So it's a great resource. And there are continuing education units associated with many of our courses as well. So if you're somebody who could use some of those continuing ed hours, wanted to let you know that's available. So this one is our ACT to address youth cessation. That's the one that I was just talking about. That is to support anybody who wants to be able to offer the Ask, Counsel, Treat, and provide some guidance and support for them. This is just a quick look at the Tobacco-Free Schools Initiative, the policy assessment, and that just walks you through those policy components and helps you identify where there might be gaps or what other components there you might need to consider or review or improve upon. Just a helpful tool for you and others that might be at the school. This is just a little bit about our tobacco basics. So for somebody who's like, I'm just not as familiar with the tobacco products, I don't even know where to start, this is a good foundational program. How to help people quit is really more addressed towards adults. It's similar to ACT to address youth cessation, but really more focuses on it includes a little bit more on motivational interviewing and does include the medication pieces of it for FDA approved medications, which really is more relevant for adults than it is for youth, but can also be a helpful tool. And we have our Ask, Advise, Refer to Quit, Don't Switch. That's encouraging tobacco users to quit and quit for good as opposed to switching over to e-cigarettes or other products. So another training available there. And we have our Adult Freedom from Smoking training that's also available. And we have a number of toolkits available from this lung.org/empower your community, or you can use the QR code, and that will get you to a series of toolkits that include evidence-based practices, resources, other tips and materials for a variety of different population groups or different groups. And we will be having one for youth and young adults that will be released later this spring. So be on the lookout for that, and we'll be sending you information about that. But it includes a number of other groups that you may work with and want to focus a little bit more on. Almost done with the resources here. We have our youth and young adults in action, our youth empowerment page. So there are some resources if you want to engage maybe your health classes or your other students that might be interested, your STAND students, if you work with STAND, maybe there's some activities that they might be interested in. So there's some great resources available on that page. And then these are some additional non-lung association, but partner resources that are available. The FDA's My Vaping Mistake, The Real Cost of Vapes. There are a whole series of real life, real student, real stories where they share the impact that their vaping has had, and they're little 1 to 3 minute vignettes, and it's a great resource. In fact, for INDEPTH Online, almost all of the modules include samples of some of those videos. And then there are some additional resource pages and some other partner activities as well. Okay. So here's our chance for some group discussion. I want to hear from you. Let's see, I'm going to try to look in the chat and see if there are other questions. Berenice asks, has the program been peer reviewed? So we do work with a third-party evaluator. Public Health Management's PHMC, Public Health Management Corporation, their research and evaluation division. They evaluate our programs on a regular basis. So the INDEPTH program has been around for over 25 years. It actually was one of the components of the Not on Tobacco program. It was just called Alternative to Suspension. So it's been around for a number of years. We just kind of relaunched it back in 2020 with updated content to reflect more on vaping and newer tobacco products. So, but we do an annual evaluation, and we'll continue to build on that evaluation. We did a pilot series of the program to evaluate the outcomes of that initially, and I'm happy to provide you with evaluation reports if you would like to see those. Happy to share that. All right, so what, let me ask the group and see where folks are sitting right now. What have been, do we have any successes to start with? Do we have some folks that have been able to connect with schools and are offering INDEPTH, or are just about ready to offer INDEPTH? Anybody want to be brave and come on the call and share some of the successes that you've had? Amanda. Yay! Yeah. Thank you, Amanda.
So we don't have it implemented yet, but I have a few different places that are very interested, and we're getting to the stage where we're rolling it out, and they have people training to facilitate. So one program that I'm really excited about is youth probation. So they are looking at using this program for their students that currently vape as a class that, and getting the certificate at the end is a big deal because it's showing the courts that they're accomplishing and working at something. So this is something that we're looking at rolling out really soon with the youth probation, and I'm excited. And then
Great.
I have a public school and a charter school where we're in the admin talking stage for next year.
Wonderful. Wonderful. So glad to hear that. Thank you. Anyone else? Appreciate that, Amanda. All right. Sometimes it's easier to talk about the challenges than it is our successes. So let's go on the flip side of that. What have been some of the barriers that you have experienced to working with schools or administrators or community partners? You can put it in the chat, or you can speak up.
I can go one more time
again.
And
Great.
then I'll be quiet, I promise.
No, that's okay.
So I was actually an administrator at a high school until last year. So I know very well some of the challenges. And I think, and what I'm hearing from other admin too, is they're so overwhelmed, it's hard to even want to implement something right now, just because it's one more thing to do. And also for school switching from out of school suspension to like an in-school suspension, finding staff and people to actually work that. Teachers are already super overwhelmed. And I did the training for INDEPTH and it doesn't take long, but even that, asking a teacher to do it, just asking them can be overwhelming. And I think just staffing is a big thing.
I think helping them to break it down and understand that they don't have to do it all at once, or, that what that might look like can be helpful. So, Alexia.
I agree. We've come up with some challenges, not only with INDEPTH, but also in other programs when we schedule in with schools, with our teachers, is that we have the same experience of, just having teachers so busy with other tasks that they have to do that it almost feels like we are unable to have those like initial conversations with them as far as like when can we find time to schedule for this training, and then also just being able to to have those finding those like leaders within our schools and communities, because sometimes again with staffing, we might make some connections and then there's some staff turnover, and so we have to reestablish those connections again. So we've seen that as a bit of a challenge as well.
Sure. Yeah, capacity is always, staff capacity and time is probably a constant issue for all programs, right? Not just for this. Want to help them try to find solutions and answers to those kinds of things, but they don't even have time to even investigate in many cases. So thank you for that. And Berenice said she has the same experience as Amanda. So anyone else? Okay. Another question that I have for you is what or who, maybe I should say, who have you identified as key champions for program implementation? Or maybe let's even brainstorm. So maybe you haven't identified key champions, but who are the folks that you're trying to reach out to? Who are the people that you think can help you kind of advance this, I think we should offer this. Who are you working with? Alexia.
So we found that school resource officers are great champions within the school systems to reach out to when wanting to implement. And that goes for just like our other programs in the past as well. They're very great on kind of getting the ball rolling and getting things scheduled out as far as like trainings or even classes for different programs. So there are some really good champions.
Wonderful. Anyone else? Put it in the chat if you're being shy. All right. Well, in the interest of time, one of my additional questions that I had was, what additional support do you need to help you successfully implement? And rather than asking that question, I'm going to pass it over to Alyssa and have her talk through a little bit about what we're doing for technical assistance and how else we can support you.
Hey, good afternoon. Thanks, Michelle. So I'm part of the technical assistance team working with Michelle and Patrick on this work in Arizona. And some of the things that we're doing is the needs assessment, the survey that has been shared and sent out over the last month and a half, 2 months. If you filled that out a week or so ago, I sent an email to the people who responded. So if you did the survey and didn't hear from me, either check your junk or shoot me another email. I can put my email back in the chat to make sure. There was a few that were undeliverable for, I think, just internet reasons. They didn't want to connect. So check on that and check back in with me so that we can share all of our wonderful resources and our time to help you guys be successful. Other things we're doing for technical assistance include the things like this webinar. We are down here in the bolded best practices and future implementation, and they're recorded and can be viewed by people who have missed it. Or if you just can't remember something we talked about and want to go back and look at. And I believe Patrick and Michelle have access to those. So if you need to be sent those links specifically, they're the ones you'll reach out to for that. And then we don't want you guys to feel alone in this project. If this is what we're getting in depth into the schools in your community. And so we would love to schedule one-on-ones to listen to what you guys need. And if you're not the the particular person at the school who needs this, then connecting us with that person is also very helpful to make sure that school policy supports doing this and code of conduct and all of that. And so you're not alone. We're here for you. And then next slide, Michelle. And then something coming down the pipe very soon. We are finalizing some incentives that we can share with programs, schools that are implementing. And so this will include posters or signage, promotional materials. We're getting some student toolkits put together for schools that are implementing, as well as some kits for staff that will be implementing. And so while we're working out a couple of the kinks on that to make sure that it matches what we can do within our funding for this, as soon as we've got that ironed out and in a nice readable fashion so that you understand what we need for dispersing these incentives, that will be emailed out as soon as possible. So keep an eye on your emails for that. It'll likely come from Patrick since he's got the big email list. And we really want to make implementing this as easy as possible. And for those schools, the teachers that, they'd love it, but they don't have the time, maybe this could be that extra little thing to be like, okay, we'll put some time into it because we're going to get something back for it. And I think that's what I've got for this, Michelle.
Great, thank you, Alyssa. So for those of you who maybe are new on the call, or if you have not completed the survey yet, here's the link to it. We can also send a link follow-up afterwards. But I would encourage you, so that we have a better understanding of what you do need, or where you are in your process. Certainly want to help provide that to you. So it's not too late if you haven't filled out the survey to still be a part of it. And then with that, I want to just wrap things up. I've got 3 slides that just show questions. But I want to go to the last one that has our contact information. So I will leave it open. I know we have just a few minutes left, but want to just leave the mic open for a few minutes if people do have questions. And otherwise, we'll leave this up on the screen for you to reach out to us individually if that's easier. Oh, thank you, Bernice. Appreciate that. We are here to support you, so. And I want to give a shout out and a thank you to Yvette, who is our funder. So Yvette, thank you for being on the line today. I don't know if you have any comments or if you want to say anything, but we can't offer this technical assistance like we can without your support. So thank you for being on today.
Yes, thank you guys for a great webinar today, and thank you to everyone who joined. We're so appreciative of the feedback, success stories, challenges. We'll continue to work through those things on our end as we build out these contracts to continue this service, but always great to hear from you all. Thank you.
Thanks. All right, well, be on the lookout for some additional links and resources in the coming weeks. But by all means, in the meantime, if you have any questions or if you need anything from us, feel free to reach out. And with that, I hope you all have a great rest of your day and a great rest of your week. Thank you all for being here today. Thank you.